Hello, Baridi Health family. If you're over 60, you might wonder which nutrients pack the biggest punch for heart health. Today, we're diving into magnesium, an unsung hero that could be a game changer for your cardiovascular wellness. Stay tuned.
As we age, up to 50% of older adults in Western countries experience chronic latent magnesium deficiency due to factors like lower dietary intake, medication interactions, and reduced absorption in the gut. This subtle deficit often goes unnoticed, yet it can set the stage for serious heart complications.
High blood pressure remains a leading risk factor for heart disease. Magnesium helps relax blood vessels and regulate vascular tone. A meta-analysis of randomized controlled trials found that supplementation can lower systolic and diastolic blood pressure by around 2 to 3 millimeters of mercury, especially at doses of 400 milligrams per day. Even modest reductions can translate to significant cardiovascular risk reduction over time.
Magnesium's stabilizing effect on cardiac cells also contributes to rhythm maintenance. In a clinical study, perioperative magnesium sulfate prophylaxis reduced the incidence of new-onset atrial fibrillation in elderly surgical patients compared to placebo. Maintaining optimal magnesium levels may therefore help guard against both atrial and ventricular arrhythmias.
Beyond blood pressure and rhythm, low magnesium intake is linked to higher rates of coronary heart disease, stroke, and total cardiovascular mortality. A review concluded that deficient intake predisposes older adults to greater cardiovascular disease events and death, underscoring magnesium's protective role.
The NIH recommends 400 to 420 milligrams per day for men over 51 and 310 to 320 milligrams per day for women over 51 to support general health. Remember, these values include magnesium from food and supplements combined.
You can boost your magnesium naturally with foods like spinach, Swiss chard, almonds, pumpkin seeds, legumes, and whole grains. For example, 1 cooked cup of spinach provides about 157 milligrams of magnesium, nearly half a day's needs for many seniors.
If you struggle to meet intake through diet alone, supplements can help. Forms like magnesium citrate, lactate, and chloride are more bioavailable than oxide. Keep supplemental magnesium less than or equal to 350 milligrams per day to avoid side effects like diarrhea and abdominal cramps. And always stagger with medications like bisphosphonates to prevent absorption issues.
In a pilot trial of adults age 55 and older, 400 milligrams per day of magnesium for 12 weeks was safe, well-tolerated, and effectively raised serum magnesium levels, laying the groundwork for larger studies on health outcomes. Although more research is ongoing, these findings suggest real benefits for heart health in seniors. So, if you're over 60, consider checking your magnesium status with your healthcare provider. Boost your intake through leafy greens, nuts, seeds, or a well-chosen supplement, and give your heart the support it deserves. Don't forget to like, subscribe, and hit the bell so you never miss our science-backed health tips. Thanks for watching Baridi Health. Here's to your heart health.